Hello, and welcome to another episode of the Med Device Cyber Podcast. We're joined here today by a very special guest, José Acosta, who I recently met on a trip to Boston, where we had some really interesting conversations about new application for AI in healthcare and seeing what some of the wonderful things that can happen as a result of this new technology, while still understanding there's a little bit of a safety balance we need to have in place there, as well as, of course, security. I'm also joined by our co-host, Christian Espinosa. And I'll start with you, Jose. How are you doing today?
Yeah, Trevor, I'm doing great. It's great to see you, and it's great to meet Christian.
Yeah, and you're back in New Mexico now, in Albuquerque. Is that right?
Correct. I live in New Mexico. I work in St. Louis and parts in between.
Awesome. And then, Christian, you're coming in from Phoenix today, right? I know it's kind of hard to pin down where you are in the world at any moment.
I'm in Tempe area, Phoenix area. Yep, Tempe, Arizona. I used to live in St. Louis area, Jose, back in the day. Used to teach at Washington University a little bit and lived in Illinois.
So pretty interesting, Christian. The first time I went to St. Louis was back in 1979, and I was had transferred from college in Puerto Rico to WashU. So I was there from 79 through 81. And all the summers in between.
Cool. So you're an advocate for AI literacy, Jose, it sounds like. So when we talk about AI literacy, from what lens are you referring to? I know we talked a little bit before we started recording, but maybe you can elaborate a little bit.
Sure. Christian, let me give you a little bit of my background, and that way it'll kind of give context to where I'm coming from in terms of AI literacy. Graduated 40 years ago from medical school, trained as a surgeon, trained as a trauma surgeon, and served in the Navy for the next 30 years. And the vast majority of that was at the bedside, but towards the end of my naval career, I moved from the bedside to the C-suite, finishing as the command surgeon for the U.S. Pacific Fleet. And so retired several years ago, always have been an early adopter. And so that kind of gives you a frame of where I'm coming from. When I talk about AI literacy, it really focuses mainly on large language models, but you could extend it to the other tools in AI. And what I'm really interested as a physician is that the students that we are training for the future understand the technology way beyond just a simple prompt, understand some of the math that's used for the prediction, that individuals understand where these models are not accurate, get an understanding of privacy in terms of leakage of information that's put into one of these large language models. And so it's the entire spectrum from understanding the technology, some of the basic tools, understanding that all these models are somewhat different, understanding how to interface with them with the correct prompts, understanding governance, which is very important, and ethics. So you see, it's a lot of things, not just I open my LLM and put in a prompt and there we go.
Awesome. And from curious to your take, I think AI is fairly just decent for diagnostics, like image enhancement with MRI or ultrasound. I think we're a little bit premature for therapeutic use of AI. Just curious what your thoughts are on that.
So Christian, very interesting. The more I use the tools, I realize that, just like you said, they're pretty good. But the problem in medicine is that you have to be precise. And so I was talking to Trevor when I was in Boston. I had just learned about alignment in these models, and I had looked at some of the tools and some of the information related to alignment. And one of the big LLMs had a graph that I found very interesting that had the alignment, a specific topic, and what percent of the times did the chats meet that requirement. And it was pretty good. It was 85, 90, 95%. But the problem is in medicine, you have to be as close to 100% as possible. And so that is what I think providers end up against, which is, for example, some of the AI imaging tools, they're great. And I know there's been some approved by the FDA, and they pre-screen studies, and they're good. But when you get down to precision, I don't think it's there yet. And that's on the imaging side, which is certainly much more advanced, right, with the number of FDA approvals. But the diagnostic even more. So I think, Christian, it's breaking that barrier. Precision for a physician means a lot more than precision to other users.
I think it's another interesting area where, obviously people can't be 100% precise 100% of the time either. And so I think that we're going to start seeing a shift where I don't believe there'll ever be a perfect solution. I don't think that people will ever be able to get it right 100% of the time, nor do I think AI will be able to. But I think that we're going to start seeing ourselves getting closer to a point where AI and humans are making similar decisions at similar accuracy the closer we get to just seeing how mature these models can become. I also think that it's worth thinking about what is the context that we're building these AIs around. Thinking about a huge LLM, Claude, ChatGPT, Gemini, something like that. There's so much context going into what it's trying to do. And yeah, seeing something 85, 90, 95% accuracy, that is pretty good, but it's pulling context from other sources to try to get to these answers that it's providing, and trying to refine that. Of course, getting into the conversation of how you're properly training AI models, then that can go down its own rabbit hole. But ensuring that we have the right background and the right context can help bridge that gap a little bit more and more, I think, as we're getting more mature with AI models.
And the thing is, Trevor, I just was listening to a podcast, the Hard Fork, from the New York Times, and they had one of the senior people from Waymo that was discussing their service, right? And what caught my interest was that Waymo is safer than if you are driving by yourself. And they have the data to prove that. And so in medicine, we are very big on show me. And I think we're early. We're still early. There's not enough literature, peer-reviewed literature, which takes forever. But there isn't enough to say, listen, these models are good, and they are in many cases as good or better than the clinician operating them. I don't think we have that data just yet. And it goes back to, it's such a complex, those models are so complex that when you publish, you're going to have to say, I published with this model. Here's the AI model card. This is the day I did it, and these are the results I obtained. Or you're going to have to go to an open access model, right? That's not going to change, but it's going to be very important as we do the literature, as we create literature on the topic of safety and accuracy, that the people writing the papers understand the difference in these tools. That's key.
I think one other thing with AI, of course, with our focus, we're more understanding how is AI secure? And as part of that, it's an element within an overall FDA submission. I think that Christian and I can lose sight a little bit sometimes on how much goes into this submission, since we have such a small focus on just this cybersecurity portion. We want to make sure we're getting that right 100%, as opposed to trying to be more generalist in that regard. But point being, there's such a big focus on security in our lens with AI due to the reason that you can't try to hack into a clinician. You can't try to hack into a surgeon. You can hack into a computer. You could try to compromise information systems like that. Or with the use of AI, it's a little bit of this Wild West scenario where it's still so new and the security considerations around it are evolving so fast that I'm a little bit concerned about seeing some of the different applications that it's entering without understanding exactly how we can kind of tighten the reins a little bit on how it's safely and securely used. And so I do think that obviously there are tons of benefits to having AI in these medical environments, but we have to be aware of some of the risks that can go into it. I'll go back to my earlier example of the training data. How do we know that this training data hasn't been poisoned when it's being fed into the AI? How do we know that the output hasn't been tampered with? How do we know that the model is actually purpose-built for this task in a secure and safe, effective manner? So looking at it from that lens obviously is a little bit different from our perspective, but I think it's a very big piece of the puzzle with AI that's been a little bit difficult to solve recently.
Well, I think with what Jose said earlier, if we're getting 85% accurate with AI, that's not accurate enough. And the case that always comes up in my mind is where the AI wellness / therapy app, where it was providing therapy to a suicidal patient, and after a couple months, the app told the patient to go ahead and kill themselves, and the patient killed themselves. And the parents and the family are suing that company, but again, that's the 15% that got it wrong, and that even if it's 1%, and that's use is not, the risk is too great, right? Because it's a human would probably not say that, I'm assuming, but the AI did for various reasons. So it's not even really a cybersecurity issue. We can certainly inject things into the model and make it say that, but this is just a model challenge.
Right. And the thing is, Christian, that the alignment piece. So having read it's called Open Spec, which is OpenAI's, and I think it's from September, their most recent alignment, you realize that there is the models there, then you have alignment, and then you have the user. And so what goes into that alignment is very important, right? And then also the other thing is drift. So, and I've noticed it. I use it all the time. I use it a lot for research, and I use it a lot for coding, one of the statistical programs. And even in a session, you see it drift. Then you have to come back and say, no, please don't give me a lecture. Provide me this. And so all those things make it, I believe, we're very early. And again, I'm an early adopter, so I'm a firm believer, and I think it has its place. But I think in terms of security, providers have to, understand that the data is not going to be lost, that people know how to use it. So I think it's all these things put together. And that's why I'm pushing the AI literacy, because, providers don't even know the question to ask. Don't even know the questions to ask. So if a patient were to come to my office when I was in practice and say, listen, doc, I just got off using a large language model and I have gallstones and I'm symptomatic, but I went in there and it said, just bear down, you'll be fine, right? I have to be able to tell the person why that is not correct, as opposed to, I don't believe in it. You have to say, no, listen, which model? And you're not going to ask them 20 questions, but you have to explain to them how these tools are not precise.
So with how we're seeing some of these trends shift in AI, how we're seeing it become more and more commonplace, I'd be curious to hear your thoughts, what you'd expect to be some of the biggest shifts and breakthroughs in the next maybe year, 5 years, 10 years, where we really see AI taking the healthcare industry from here.
Okay, so I'm going to start one area, and that is ambient AI scribes. So ambient AI scribes, and just to give a little bit of context, I go back to when we used to write notes on paper. And so you would sit down with your patient, you'd speak to the patient as they're speaking, you're taking notes, but you had some interaction. Then we moved to data entry physicians. So the physicians still, maybe there's a percentage of physicians that do data entry. So you sit there in the clinic for an appointment, and the doc is asking you questions and entering data. Because if you don't enter the data now, you're going to be doing it tonight. Very famously called pajama time, right? It's work after hours. Okay. The ambient scribe AI allows you to speak with the patient. And then in the background, it is the tool is capturing that information, creating a document that makes sense. And not only that, but populating all the different fields from that are in the electronic health record. So I believe that's a big move. I'd say certainly being adopted a lot more in the academic medical centers, but it's a billions of dollar industry, and I may be overdoing it, but it's a big deal. So I think that is an area that's going to really help in many ways, right? It's going to help with being more accurate in your medical record, getting information promptly, maybe decreasing the amount of time, pajama time. Although, Trevor, there's always risk that an administrator may say, you saved half an hour. We can probably sneak in there like 2 or 3 more patients. So there's that. You have to be careful with that. But I would say that's a big one. Certainly imaging, but the imaging thing's very interesting, Trevor. I read a lot of this AI stuff, and there was a projection that by maybe in a couple of years we would do away with radiologists, and the reality is we need more radiologists now than ever, right? Because radiology is not only reading the film, it starts by deciding, are you getting the right study, all the way to providing consultation to the referring physician. So AI will be in that field. AI will assist the radiologist. At this point, AI will not replace the profession of radiology. So those are a couple of areas I think important. Research, I think we're going to be seeing, the establishment give in. Right now, many of them say, don't, if you're touching AI, don't send us your manuscript. I think we're going to see a movement using, being allowed to use more AI support in when we're doing research.
I think that AI scribe example is especially really interesting. I know I use a tool called Otter AI, which essentially, it just captures your meeting notes, and I love it. I ran out of credits for it the other day, and I felt like I was thrown into the Stone Age. I had to go back to taking notes manually. But one thing I always think about is there have to be guardrails around how I'm using a tool like that. When I pull it up, I look at what happened during this meeting, and it might say, oh, you told Tom you would give him 10 apples. I go, I don't remember saying that. Where did you get this information from? And it's misquoting or trying to summarize something that I that I said differently. And so when I look at the actual source of where it's coming from, I get how it gets to this conclusion, but it's inaccurate. And I would be concerned about if I'm going through a long conversation with my physician, talking about what problems I have, and there's an AI scribe to try to get through a little bit more of, what actually happened during this encounter. There should definitely be some guardrails in place on how to safely and effectively use a tool like that. And it goes right back to your point on AI literacy. The physician needs to understand what are the limitations of a tool like this. Where can there be a potential risk that's introduced? Of course, if we're going through this conversation, the AI summarizes everything and says, based on this conversation, it sounds like the patient should start on extreme example, but should start on radiation treatment. Without that being necessary, and the physician doesn't go through the process of verifying it, there can be a lot of risk introduced. So I think that the user facing and the user education element is vital with a tool like that, and understanding that it's used in a safe and secure context.
And I'll give you an example. So New England Journal of Medicine, probably within the last 3 or 4 months, a provider, a primary care provider, was writing a little editorial piece, and he was talking about chit chat. And he said, I love these tools. I've been using them for a year. When I go back and look at my notes, it's missing some of that human touch, right? Which is very important to get to know your patient, for your patient to trust you. How's your daughter doing? And all this. Okay, so he pulls the string and he realizes that as part of the alignment of the tool for the practice, it was decided, and I'm not sure who decided, but that extraneous, quote unquote, extraneous information would not be included in the note. And so it's that when I mean AI literacy, that doc can go back and say, hold on, as part of the governance, right? The governance, that's why it's so important. Hold it. I think we should include some of that. So I think that's important. I'm trying to figure out if the FDA is involved in approving those tools or not. I can't remember if it's if it's considered a medical device or not. I know there's a definition, but I can't remember it right now.
I think something interesting you said, Jose, is, which a lot of people probably haven't thought about, is if we're using these AI scribes, the healthcare delivery organization is going to force, at some point, they're going to say, we're more efficient, you can see more patients, which is actually going to introduce risk as well to the patient because there's not adequate time with each patient. And I say this because I have indirect experience. My wife is a nurse, and she used to work in the ICU, and they would give her 6 or more patients, and they're only supposed to give her 4. And it's like they're always this constant battle of like trying to do more with less. And if we're starting to rely on AI to take notes or to be the scribe, I feel like we're going to push more appointments, and our healthcare is actually going to get worse because we don't have adequate time to make a diagnosis.
Well, Christian, so I'm a fan of nurses, right? I'll just a little brief story. So my dad was a physician, and he's passed some years ago, but physician, and I remember when I graduated from medical school, he says, "I'm going to give you some advice, very important advice." And I said, oh, "Okay." At that age, your dad doesn't know that much, and eventually they know a lot more. But so he says, every day in the morning, read the nurse's notes. If you want to find out what happened to that patient overnight, don't ask a resident. Don't read the nurse's notes. So you can imagine how important those notes are. And if you, a lot of the nursing notes have gone to check boxes. But imagine if you had the ability to wear a headset and you're going through your day, you're giving medications, you're giving advice, you're discharging patients, and that all that information is being captured and boom shakalaka put into the record in a way that is of value, right? I think that there is a use for ambient AI, one of the things that I think I mentioned to Trevor was what's been called the productivity paradox with these large language models and AI, where I forget, there was a company that did a survey of not CEOs but the people that use them, and around 75% said, "Listen, it's more work than ever." And there were 3 reasons. One is I have to check everything that comes out of there, right? Especially if you're using it at work, an engineer, you name it. Okay. Number 2, I find myself having to learn one more tool, just one more tool. And, there's a lot of promises, Christian, about tools and how good they are. When you start using them, you realize maybe they're not as good. And then the third piece is what we're talking about, which is the boss gives you a tool, spends all this money. We create a fenced in, we do RAG, we do all this stuff. But I want you to do just a little bit more. And so at least, that's one of the concerns. Again, I'm a big believer, but it goes back to AI literacy, that we can have this conversation.
Well, I expect Trevor to do more since I gave him more otter credits.
Look, I think my productivity's doubled now that I have my otter credits back. So
you see. Yeah, well, but with a little tongue in cheek, but the truth is, right, that that's where I see these tools. I don't see these tools replacing Trevor. I don't. I mean, I don't. But certainly, I see him, helping Trevor and do his job. Like so many have said, you're not going to be replaced by AI. You're going to be replaced by the person that knows how to use it. That's who's going to replace you in the workplace. So a lot of interesting things.
And there's a lot to learning how to use AI. I just did some training this morning with my team, the sales team, on how to do prospecting using AI and using other tools. But it's interesting because AI will give you an answer, but if you say, give me the best you got. It'll give you a better answer. Then you say, give me one better. It'll just keep getting better. But it's like, why didn't it give you the best one initially? So I always, when I'm teaching people about AI, it's like, if you tell it you want a good message, it's going to give you a good one. If you tell it you want an outstanding message, it'll give you something better. So it's like these little things that people don't think about with AI from a literacy perspective. It's really, like you said, it's going to become about how good somebody is at using AI, really. And that will determine their success with AI and how much they understand about it.
And there's I don't know if you could say a science, but there's certainly a lot of literature, a lot on the prompting, right? On the prompting model, persona, la, 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 la. So that is important. I had somebody the other day say, oh, very soon we're not going to need prompting. And I disagree for now. Now, I'm going to tell you what I see happening, Christian and Trevor. So when I was in school, they taught you how to write, calligraphy. Then, early adopter, my mom put me in typing classes. And I ahead of the game on typing classes. Here's what I suspect. Children will learn how to prompt. They won't know how to write. They won't know how to, typing is important still, but it'll be, the kids, when they arrive in college, they will be experts at prompting and squeezing all the juice out of these tools. Just like you said, Christian, right? Give me the best up front. Don't waste my time.
Seeing that shift, I think you're totally right. We'll probably see a shift towards how do you effectively use AI tools. And I think that right now, without those resources, it is a little bit interesting to see how AI is used and seeing how AI can be used more effectively or less effectively. And I think that people who spend time around AI a lot are obviously going to know it very well. But if you're not exposed to these more complex AI problems, you aren't going to try to weasel out the better answers. You aren't going to try to figure out, oh, I don't know if this is accurate. You'll say to ChatGPT, give me here's a list of symptoms. Give me the top 10 things that it could be. And it's going to say, boom, 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 boom. And you might not know enough to say, hey, actually, you missed this symptom, or you added on this extra area. Can you refine this list? Can you provide it based off of XYZ context? And so that education point, that literacy part of this equation is so important in making sure that people are doing these tasks and using these tools effectively.
And you have to be careful, because if you show up with a list of 10 differential diagnoses, now you put the physician and a physician assistant, nurses, PA, everybody, right? You put them in, you might send them down a rabbit hole, right? So can you imagine you're on the ward, right? And you're sick, and you spend most of the time interfacing with your nurse, right? That's where you spend your time interfacing. The doc comes in every so often, but okay. And so can you imagine you have a list of 10 things and you say, hey, can you look at this list of 10 things? And can you tell me what you guys are missing? And so it's that being able to come back and say, no, this list, these are the concerns with it, la, 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 la. So that's the other thing, right?
I wonder how often someone comes ready to the doctor's office with, I asked ChatGPT what's wrong with me, and it thinks this. You have to do X, Y, and Z. I'd imagine that is a constant headache for physicians.
It's interesting, Trevor, that you bring that up, because everybody's different. Every person is a little bit different. There are patients, and that one, I always tell, my last operative case was in 2018, so it's been a little bit, but there would be patients that would say, doc, don't give me all this baloney. Help me, like I was a family member of yours. And then you have others that come in and are very specific. So you get it's a mixture. It's a mixture of things. But you have to be ready to deal with all those, right? All those, the empathy part, all the way to the person that knows more about the specific topic than you do, because they read it on the internet.
Everyone who has access to the internet is an expert on everything, it seems like.
Yeah. I think it's interesting that we're talking about in school learning how to prompt AI. like as a foundation, when we still haven't added things like how to set a goal, how to have emotional intelligence, how to balance a checkbook. Some of the fundamental things are still not in school, but we're talking, it probably will happen, like how to program AI, and we've skipped all these other things that actually matter, in my opinion, from a education perspective.
I did learn how to balance a checkbook in school, but I can count on one hand the amount of times I've actually had to write a check.
Well, it's not so much the checkbook; it's managed money, I would say.
Yeah.
It's funny because I heard something about this recently. The person, I forget, but the person was saying we're great at doing complex things, right? So we were able to get a human being, a person, to the moon before we put wheels on our suitcases. So we like the complex. We go for the complex. But I'm telling you, I'm from the era, and I'm sure both of you are too, that suitcases without wheels. And that was terrible. That was terrible. And so we went to the moon before we were able to get those little spinners on. And so that may be, Christian, what we're talking about, that we go for the complex, or, we don't want to address emotional intelligence, and we have difficulty addressing goals.
Yeah, and I think it could be more commonplace things, a suitcase, or dealing with money, dealing with finances, these common things everyone has to deal with, just the mundane parts of life. It's not as exciting to try to innovate as saying, we're trying to make computers think like people. We're trying to make them talk like people, do things nobody could have ever imagined. That's exciting. That's cutting edge. Everyone wants to be a part of it. But going back to, if someone adds wheels to this suitcase, it's going to make a lot of lives easier. Yeah, it's just a suitcase, though. It's not as exciting. And so I think you're right. People try to get caught up in exciting, complicated, difficult things and leave some more very important but simpler problems to the wayward.
Cool. Well, we're coming up on time. So let's, I usually go around the room and ask for some last minute words of wisdom about AI in this context, and maybe some predictions for the future. So I'll start with you, Trevor, then we'll go over to Jose.
I think a really important thing to keep in mind, listening to this as a medtech innovator or as an early adopter, someone trying to integrate AI into your workflow, into your healthcare delivery organization, your product, whatever it is understand what goes into your AI is what you're getting out of it. Garbage in, garbage out. High quality training is going to lead to high quality results. And it's not something that you can rush. You can't just throw questions into an AI and hope for the best, or just plug it into a use case and expect it to work. Focus on what you're putting into it, focus on what you're getting out of it, and take your time with trying to iterate and produce meaningful results with AI.
All right, Jose, what's your last minute words of wisdom here?
Just a couple of things. First, to thank Christian, you, and Trevor for inviting me. I mean, it's a big deal for me. My first podcast, so it's a big deal. So that's number one. Thank you. Number two, like I mentioned earlier, I'm an early adopter. I believe that there's going to be tremendous growth, and these tools are going to help us, and they're going to improve our life. In many different domains, I think understanding them, AI literacy is key, and having guardrails. Things, privacy, ethics, governance, etc. But again, I see in terms of in medicine, the growth will be in the ambient scribe. It's going at an incredible pace. I think in 2 or 3 years from now, it'll be a thing of the past talking about it. We will expect for that to work. In terms of diagnosis and in terms of treatment, I think it will complement the physician, the nurse, and others. But in closing, I really, again, Christian, thank you. Trevor, thank you. I really appreciate it. And I appreciate what you guys do, because you're on the safety side of this. You really, I know you may not think about it, but you're on the safety side of this, and very appreciative.
Well, thank you. Yeah, we're on the patient safety side, and you mentioned Waymo earlier. So I will, I guess, back up what both you said. I think we need to take our time with AI. Here in Phoenix, where I live, I take Waymos all the time. And there's a scenario where I was in a Waymo It was behind a construction truck that had a signal going left and one going right. And the Waymo literally just went back and forth like this. It couldn't figure out what to do, which side to go around. And I think a human had to take over and tell the Waymo what to do to go around the left side. So I think we're still at that state, and we'll be at that state for a long time with AI, where we still need that human interaction, because it's going to be quite some time before we mature with AI.
We get the Waymo takeover notifications from manual override all the time if you're ever taking one by Oracle Park during a game. The whole city just, yeah, the traffic is so bad in downtown. There'll be a little pop-up. It's like, hey, just letting you know I'm getting you through this traffic, and then we'll get you back on the road. And then the Waymo takes back over once you get out of downtown.
Oh, I haven't had that many takeovers here, just a few. I guess you got more traffic maybe in San Francisco area.
Yeah, and the roads here just make no sense.
Well, thanks again, Jose, for joining us. And thanks, everyone, for tuning in. We hope to see you on the next episode of the Med Device Cyber Podcast.